Well, welcome everybody to another episode of the Abundant Wellness with Andrea podcast. Today we have the incredible privilege of having Joshua Moore, licensed mental health counselor, did I say that right? Board certified neurofeedback practitioner, and the owner of Alternative Behavioral Therapies Clinic here in Vancouver, Washington. Joshua, thank you for being here today. I am really excited for this conversation on trauma, emotional health, different modalities that we can really use to help people feel better, not only in their bodies, but function better overall, regardless of their diagnosis or their personal challenges. So thank you for being on here today. One of the exceptions to you have to feel it to heal it. Is that within that realm?
Right. I think EMDR is a great example of kind of where, and I don't know if it's where it came from, but you got to feel it to heal it is a common phrase I hear from EMDR practitioners. And again, there's a certain catharsis to going through something tough. Like if I can bring a client through something that feels like a mountain, they're going to fully believe they can tackle anything smaller in their own life, which
Right.
is great because then they will. They become a more resilient person. They become a more competent person. Things will just come their way and they can see themselves as somebody who can handle that. And they don't have to come back to my office to do that. They just have
Right.
to know that they can do it, and they will. They won't get stumped in the future by so many other things. But there are times where instead of increasing the brain's ability to get through something horrible, I need to lower the distress in order to get them through it.
Yep.
And I think that in that cases, I like to use things like neurofeedback. I found referrals to ketamine clinics. I know Evolve Health has been successful in taking insurance for
Awesome.
most insurance providers. I think they're in Clackamas.
Okay.
Um, I know there's a strict admittance criteria, so you have to go through, a psychologist or something, I suspect.
Okay.
But very useful. It's better to have done psychotherapy, getting you kind of the appropriate internal family system perspective on yourself before
Yes.
doing those protocols, in my opinion.
Well, yeah, I think
Mhm.
that makes a lot of sense though, because you kind of have to have at least I'll just share from my own experience because I've
Yeah,
done
go ahead,
both.
please.
And I've done
Hmm.
EMDR as well. And they're all
Hmm.
I'm sorry, neurofeedback as well.
Hmm.
For, different modalities for different things. And they've all been useful. But having
Hmm.
had, I want to say like 1 or 2 years of some combination of like talk CBT therapy, and it was immensely helpful, and it actually gave me language to understand what I was processing in EMDR, to where then I
Hmm.
had this cohesive story, right, of like, this is what's happening. Oh, that makes sense because we've already walked through all of this stuff. So but then it came a point where I'm like, okay, I've talked this thing into the ground and now
Hmm.
it's like I'm still having the emotional or somatic experience
Hmm.
that is not I'm not where I want to be yet. Like I'm not the functioning to the degree that I want to be functioning or healthy. And there's a lot more, to that story than I'm going to share on this particular
Sure.
episode. But I think that's where it is very beneficial to be working with somebody that knows when you've reached your limit on something and when it's time
Hmm.
to address it in a different way. Like, for example, I talk to a lot of my hormone clients about like, there has to be some level of physiologic balance before
Hmm.
we can even address the emotional stuff. Like if your B vitamins are tanked, if you're not getting enough protein, if you're not getting regular sleep, if you
Hmm.
are like drinking 5 cups of coffee a day and you're wondering why you have anxiety, like let's get that shifted a little bit and then we'll start working on, within my scope of practice, obviously, the more
Hmm.
emotional side of things. Because some of it might just be that there's something, like you said, there's something out of balance here that we got to get that stability in place before we can do some of that deeper work, and knowing that
Yes.
there's room for all of it.
Yeah. I can't tell you how many clients will come to me and they've seen 10 doctors, 10 therapists, and we do brain mapping, QEEG brain mapping, which is an interesting tool to see what's going on with the electrical system. And I'll say a case that I've seen this dozens of times, so I feel like I can tell this story. It's like no one's one story,
Right.
So they say they sleep a lot and they sleep great. Well, I look at their brain and there's a certain frequency that's a vigilance kind of compensator, and then they're showing signs of fatigue.
Mhm.
The thalamocortical system is all, desynchronized, and like, what's going on here? Like,
Yeah. What do
you
you
look
mean
like
you
someone who's
sleep great?
exhausted. And I said, yeah, I'm sleeping great. Okay, so we do a little bit of investigation and get some data off to their doctor. The doctor investigates and they have sleep apnea. It's like,
Mm.
okay, well, what would have happened if we had gone forward without that discovery?
How much progress would you
You're
really
gonna
make?
get
Yeah.
you're gonna get pennies on the dollar for your REM sleep, which is how we actually solve trauma. Yeah,
Right.
that's where like things solidify. So we're doing EMDR, we're getting all escalated, we're having these epiphanies, we're coming through the experience, and then we're going and we're sleeping, and short-term memory just can't integrate into long-term.
Right.
And then what happens is that we find ourselves having the same triggers as before because we didn't we didn't finish because the last step is really important.
Right.
you
It's,
know
yeah, very important. It's a very important
Mhm,
step. Absolutely.
mhm,
So what I'm hearing you say is that EMDR is not just for, well, I'll just say it this way. This was my misconception. And it was actually kind of a roadblock to me getting
mhm,
help with EMDR because I thought it was, well, that's only for people who are severely traumatized or only for
mhm,
people who have PTSD or CPTSD. And I definitely had markers of some complex PTSD, but I had not been formally diagnosed with that. And
mhm.
so, so what would you say to
Oh, and
somebody who maybe
there's
is
tons of people
using
who
that?
have no symptoms of PTSD and
Right.
still they let's put it this way, they don't have it yet. We'll leave it at that.
Okay.
So, I can still train. So,
Yeah.
but I don't think of EMDR as being kind of my favorite tool for chronic PTSD. I see it as being good for the mild to moderate stuff.
Yeah.
With a few specific contraindications. Now that's my opinion for my practice, so other people
Right.
might be more skilled, but I have my concerns or doubts. I'll say so.
Yeah.
There's certain things that I find I just don't want to use EMDR for this. Maybe it could be useful, but I'm going to see it hit its
Right.
wall or its limits. I think that it is a really popular therapy because it slides under the radar of talk therapy, psychotherapy. So there's no lobbying and no federal
Right.
documentation to try to get it covered. No,
Right.
it doesn't take decades to get there. And then two, it's really easy to scale, meaning that we can get a couple thousand practitioners trained a year. You just can't do that with ketamine. You can't do that with neurofeedback. It's very hard to grow these other systems, and I think that's uh, partially where some of those narratives come from. I think, though I do believe anecdotally some practitioners could use it in a scope that others or the average couldn't, just because of
Right.
skill and attachment. So so there are exceptions. So
Yeah, no, that's good. And
Mhm,
I think what I would kind of nutshell with that is that, well,
mhm,
for me, and this is how I looked
mhm,
at it, was like that was a disqualifier for me personally,
yeah,
when really there were things that EMDR was extremely beneficial,
mhm,
for
yeah.
resolving.
I've been
And
a
then
patient. Yeah.
yeah, yeah, and then
Mhm,
neurofeedback brought another layer to that
mhm,
resolve, right? Because it was helping to kind of lower the intensity of the distress
yes.
that was happening in my brain. So, and there's a whole lot more to that, like
Do
why
you
that
mind
was
if I ask what
happening.
kind of neurofeedback you did?
It was lens neurofeedback. So I don't
Oh,
think it's
great.
the
Okay, yeah.
same.
Mhm.
I don't think it's
Sure,
the
sure,
same, uh,
sure.
but
Yeah.
that was, 12 years ago, and I know it's
Oh, yeah.
developed
Mhm,
since then. So,
right. Mhm,
um, yeah, but this is, if you're listening and you're recognizing any of these
mhm,
symptoms in yourself and you're like, maybe the only available access you have is in your region, somebody that has the tools of EMDR, it's a great place to start, I would
yeah,
say. Um,
mhm,
but then also part of that learning, I think, that assertiveness or learning how to be your own advocate within the realm of your therapy experience is also recognizing when you've maybe hit a limit or a wall, and then having that conversation with your provider about, helping you to understand, why am I not seeing progress? in this area. We've done 5 sessions to resolve this one thing. Like, why is it not? Do you know what I'm saying? I think it's really important to have those brave conversations.
Yes.
Yeah, and not be thinking about it. At least I don't anymore think about it as just useful for a particular diagnosis.
Yes.
Would you say that that is accurate?
I don't find that there is a ton of congruence between when I look at the brain's electrical system using an EEG, QEEG. I don't find that there's a lot of congruence between that and the DSM.
Okay.
I think that in medicine, you're a nurse, you come from a medical background, as I did before. Yep. I think that diagnoses traditionally somewhat in medicine reflect a mechanism of action. So if you come in with a skin rash, they're not going to diagnose you with skin rash. They're going to diagnose you with whatever that is.
Right.
It could be an infection, it could be autoimmune, it could be cancer. And it really does matter which one of those it is. And we're going to identify something like what it actually is and what's actually causing it. And then mechanisms that have been researched to reasonably address that mechanism. In mental health, we don't do any of that. You're depressed. What does that mean? It's just a bunch of symptoms. How many different ways can the brain get depressed? A lot. Yeah. Okay. Yeah. Like a lot of different ways. And why? How many different reasons can the brain get depressed? A lot of different reasons. They're not all the same. It can be hormonal. It can be physical. It can be trauma related. And it does matter which one. Okay. Right. You say, well, maybe there's a better diagnosis for it than that. Like, yeah, sometimes, absolutely. But there aren't diagnoses very often. Most of them don't actually get down to, they don't get beyond describing it, just describing it better. Right. I'll give an example. Medically, there are 2 types of schizophrenia. Well, when we look at the brains of people who have schizophrenia, there's like 5 different types. And there have been studies showing that when we divide those types and look at medication utility, there are 5 different types. Right. That they are benefiting from. And by the way, I don't recommend specific meds or anything like that, based on that. Even because I'm not. If I ever hire a doctor, that'll change. Right. Right. But the brain doesn't really become very congruent with the diagnostic manual, and so I don't find a lot of utility out of it. I'm pretty good at diagnosing, but it doesn't offer me a clear path forward. In fact, right. I think DSM 1 through 3 actually had the first chapter on do not use any of these diagnoses to develop treatment plans. They're not congruent with treatment plans. And we know that in medicine, that's exactly what they do. They use the diagnosis to funnel you to a treatment plan.
Well, that's exactly, I was like, that is the exact opposite of how it's being used, at least in conventional medicine practice. And there are times where they get it right and other times where we completely miss, and like pandas is a good example of that.
Yeah. Right. Is it prescriptive or descriptive?
Exactly.
And it's descriptive. It's not prescriptive. It doesn't tell you what to do.
Right.
And so I don't have a utility for it.
Right. Or even why it's happening in the body. Because if we understand the mechanism, like, for example, pandas, a kid is coming in with OCD. Are we just going to treat that with cognitive behavioral therapy if it's an infectious source? That doesn't make sense. Like, if it's an inflammatory, like you were talking about, an autoimmune process, an inflammatory process, that's going to change how, it's going to change how we move forward, because we're looking at a different mechanism of action or a different mechanism of injury. Or for example, this was the really interesting thing with my neurofeedback experience. So I actually I'd fractured my skull, and it was undiagnosed because I was in nursing school, and I went to the doctor and they said, oh, if you didn't black out, there's no way you could have had a concussion. I'm like, well, I did, like, black flashed before my eyes. I did actually feel my brain hit the back of my skull. Like, maybe you should look into that, And they're like, no, you're totally fine. Like, I don't know what fine means, but whatever. And I definitely had post-concussive symptoms for at least 2 weeks, probably longer when I look back at that story of my, that period of my life. But then none of those symptoms really came to the surface until I was postpartum with my first. And it was like my whole thyroid adrenal axis had completely shut down. My thyroid was out of control. And thankfully, my naturopath had been trained in neurofeedback. He's like, can we map your brain? Like,
Mhm.
I can feel the
Mhm.
fracture on your head. Like, we need to look at, where this is impacting you.
Yeah.
Because it was causing insomnia. It was causing a lot of different just physiologic horrible issues. But he was the one, this is the super fascinating part. When he mapped my brain, he's like, I see survival patterns in your brain.
Mhm. Mhm.
Can you tell me like a little bit about your childhood? Like, because that does impact your physical body. He was the first person that actually helped me to put some of those pieces together of like, oh, I need to really address the mind and the body in this season, really to get the healing that I need. Um, and so, but that was really how I had discovered like, wait, my HPA axis is a hot mess, in part because there was a physical injury. So if we had
Mhm.
only
Mhm.
addressed that with maybe like medication, right, or sleep medication for the insomnia, or anxiety medication for the anxiety, but we had never looked further into what was going on with my thyroid that was
Mhm.
causing it to go so high, we would have never actually resolved what was happening in the body. So it's an extremely useful tool. And I know we'll
Right.
probably do a full other episode on neurofeedback, but I
That'd be
find
fun.
it extremely, yeah, extremely
Mhm.
interesting because it did for me personally put pieces together for my health puzzle that I was,
Mhm.
that I was very confused by. And quite honestly,
Mhm.
it was a very scary experience to have that happen,
Mhm.
after having a baby and all of a sudden your body's falling apart and you don't know why. Like it's pretty scary for people to have to go through that.
Oh
So
yeah. Oh yeah. Yeah. And Michelle's my wife. You know my wife.
yeah.
She's a therapist as well at the
Yep.
clinic. She's no stranger to postpartum issues, and after our second kid, borderline psychosis,
Oh,
extreme anxiety, throwing up in the bathroom, kind of level of anxiety,
oh,
just
yep.
intolerable. And so we did a brain map on her, and her brain had shifted to what we call a fast slow phenotype, which is what
Mm,
you see in dry drunks, or people who just are much, much, much more functional when they drink. And that's
wow.
because you give them drinks and their brain behaves normally.
Interesting.
They show as a normal brain basically when you let them drink, and when you don't, they lose their default mode network completely. They don't have an
Wow.
expression of it. Or in her case, it speeds up and becomes like it's running at 2 or 3 times the speed that it's supposed to, and that will
Wow.
give you horrible, horrible panic feelings.
Yep.
And again, alcohol tends to normalize that stuff in these people, which is why they find alcohol young and then they drink forever. And
Right.
the only solution for them that I know of outside of neurofeedback is to like go to AA and white knuckle it, and they can do well in AA, but they have to change their whole identity to orient around that, which
Right.
is tough, and they're learning to live with the physiological discomfort of not having a default mode network.
Right.
When we do some training on these people, it's very simple. We put some sensors on their head, just a few. Once we understand what's going on, we train down the fast rhythms. We train up the slow rhythms. 5, 10 sessions in, their brain kind of gets it, and you kind of see it click, and
Okay.
they'll break a sweat. They'll be like, "Whoa," and they'll say things like, "Man, I don't actually need to drink. This is actually why I drink." Like I just, it's such a validating for them to realize, like, I just drank because I was chasing what I didn't know was normal,
Yeah.
and that's a
Right.
reasonable thing to want, you know.
Right.
It can be really hard because of all the patterns of behavior and values that they've picked up along the way of drinking for so many years. Sometimes
Right.
they're not the kind of person who's ready for that kind of transition yet. Not all of them. Some of them come in the door
Right.
just ready to go, and we train up the default mode network, and man, they get it and they love it, and it is permanent. After a number
Amazing.
of repetitions, it becomes permanent.
That's amazing.
So that's probably the funnest kind of client to work with. And my wife turned into one of those, ironically. So I just
Wow.
brought the system home and left them home for a while.
Yeah.
You know? And so,
Absolutely. Well,
yeah,
yeah,
yeah. And you
she's
probably
lucky
know
that
from
she had
your,
direct access. Yeah.
well, I do sometimes wonder about our personal journeys and what they would have looked like had we not. I didn't think about it personally benefiting me, but I was injured in the army. Had a shoulder injury that developed into torticollis, which you might know what that is.
Hmm.
Yeah, so it's kind of think about like what the Hunchback of Notre Dame had, like kind of all. And
Yep.
my left ear was stuck on my left shoulder for most of the month, and I'd get kind of semi-loose for maybe 2 weeks and then stuck again. And
Wow.
when it initially acted up, I'd be stuck in bed for 3 days at least, or something like that, 1 to 3 days actually, but it could be longer, but that's probably more common. It was very rhythmic, monthly cycle that never skipped a beat for 4 years. And if you've worked in orthopedics, you'd know that if torticollis persists longer than 30 days, it's permanent in an adult.
Wow.
And I was told by the president's own physical therapist that I would not beat this, that it was permanent. And I took on physical therapy for years to no avail, and I tried neurofeedback for migraines, and the torticollis vanished. I wasn't expecting that. I wasn't trying to do that. I was actually really uncomfortable and nervous.
Yeah.
Because just the flare up not happening created panic for weeks, because I thought the pattern was, at least the one nice thing about it was I could plan my life.
Right.
I was choosing to build my own clinic because I couldn't work for anybody else. I didn't have enough sick time in any job ever to miss, 3 days a month, 3 days a month. That was a minimum amount I needed to miss. It seemed about that. And so I personally went from, and I have all my Army paperwork. I'm actually going to publish a small book and put my story in there, and I'll actually have the copies of the medical files on there.
That's awesome.
But so between myself and again, the president's own physical therapist told me that physical therapy would only slow down the inevitable descent into a wheelchair, which is where I'd be at this point in my life.
Right.
And then my own wife having, anxiety that is not conducive to live with.
Right. Well, both for herself and for herself and for everybody else in the home, right?
So fast forward both of our journeys without it, and I have no imagination for how horrible that would be, but that's what most people have.
Yeah.
These terminal kind of situations.
Absolutely.
Yeah. And I think that's it's really humbling to think about that sometimes.
It is, absolutely. And I mean, I think about the same thing. I had one I don't want to say episode of one treatment of neurofeedback, and all of the insomnia that I'd been experiencing for 9 months up to that point I went to bed like, okay, I'm just going to mentally prepare that I'm going to be awake at 2 or 3 in the morning and not be able to shut my brain off. And I slept, because what had clued it in was my daughter was sleeping through the night by that point. So I thought I was just waking up because she was waking up, but really I wasn't. I was actually having insomnia. And so that is what actually made me a believer in neurofeedback. Then I started reading all of the research articles, and I was like, holy crap, how does nobody know about this? And which is still my thought on, both EMDR and neurofeedback, but also just
we're working on that, Andrea. We'll get there. Don't worry. I won't burden you with that details in this podcast, but it will be a story in 2 years.
Yeah, which is going to be amazing. And but this is the thing that I want to encourage the listener about, is that it takes a tremendous amount of effort on people who are doing the research to actually bring the reform. So if you're in that place where you're like, I'm stuck with these symptoms, number one, know that the modalities are out there. There are modalities out there. Just because your doctor isn't talking to you about them, or your therapist isn't talking to you about them, does not mean that they're not well researched. It does not mean that there's not, evidence-based practice on these things available for you. But two, we were talking about this before we started recording, even with pandas. My daughter has pandas. She's well into her recovery, but we're not there yet. There's still layers that we need to address with that. That's been around for 40 years by this point. And it just now in the last year did they get insurance for insurance companies to recognize that it's a diagnosable, coverable disorder. 40 years. Yeah. So there are people like Josh, there are people like me. I'm not really heavy in the research realm of pushing things forward, but that are doing the work and, putting the footwork in there to bring these therapies, so that we can eventually someday, hopefully get insurance coverage, insurance to recognize the validity and the necessity of treatments like this. So I just want to say thank you for what you do. I think the work that you and your wife and your clinic are doing is absolutely amazing. I send people to you all the time. I don't know if they say that, but I do refer people to you guys all the time. I'm looking forward to getting neurofeedback for myself at some point in the near future. But what would you say, maybe just a word of encouragement for the listener? I know you treat a lot of different symptoms, but maybe that's fearful of trying again, because I think we both actually work with groups of people. At least for me, I get a lot of women, they've tried everything like for their hormones. So there's a little bit of that fear or that hopelessness of what if I try and it's not the thing that I need. So what would you say to the listener who might be feeling that way?
So first of all, you can be stronger than you think you can be. We can become something like infinitely resilient. We're not going to figure everything out. We're not going to find solutions for everything. We're not. Okay. But there is beauty in what we can become through things, nonetheless. And I don't know how to articulate that well sometimes, but I do see it. My clients teach me this often. And it's not extremely reassuring, I'm sure. But we have to find the things that let us move one step forward at a time. And those are the things that we're willing to do, the things that we're able to do. And nothing else is even worth looking at. Sometimes you just have to look at, what am I willing to do? What can I do? And that's the pool that you can draw from. And sometimes that's really slow because maybe what I can do or what I'm willing to do is just do some self-care. And focus on a little bit of taking in a little bit of learning, a little bit of education, maybe watching a podcast.
Right.
And that's one thing that I love about, the decade that I live in. There's the best information in the world is available to everyone. It doesn't cost anything. It's virtually everyone has access. You can go down to local university and get a little bit of education, but that's just local talent. You have hundreds of thousands of talented individuals putting their stuff online for free, and they're going to blow away whatever you can get locally. Yep. It's just the truth.
True. It's the truth.
and so they can absorb something while they're doing whatever they have to get by or hold it together. And there is a study that's worth understanding. It's done on pain and opioid, opioids, so medications, pain medications. I think it's worth understanding from a theory standpoint. If people are left in suffering for chronic pain, after 2 years, there's a noticeable and progressive increase in their pain tolerance.
Wow. And
there's no limit to that. And I could give stories, working at Walter Reed, about the little old lady who had bone lumbar arthritis, who thought it was stiffness. She didn't feel pain. She just had, came on gradually her whole life because she didn't do anything crazy. Yeah. And she did not want the knee replacements, the bilateral knee. She didn't want them. She didn't thought that was necessary. And then seeing another person come through with 25% arthritis and in the knees and being in extreme pain and wanting whatever anyone could give him. If we give somebody pain medication, for chronic pain, the research shows that after 2 years, there's a decrease from baseline on pain tolerance, and there's no limit to that either. And so what we reach for really, really, really matters. There's been legislation that keeps getting kicked down the road to ban opioids for chronic pain for this reason. If you hear this podcast, I'm not recommending any changes. I'm not recommending anyone do anything specific with pain meds or anything like that, but that we do want to be careful what we reach for.
Yes.
And so while you're suffering, know that time is actually your ally. In time, we do improve. We do become a more resilient version of ourselves if we don't reach for the wrong things.
Absolutely. And exactly. And, and just encouragement that it does take courage to reach out. It does take courage to take that step and say, you know what, I'm willing to try again, even if it means maybe it's not the right fit or it's not the right fit for right now. But it is, it does take a tremendous amount of courage to get your butt in the chair, and start opening up a conversation about what might be going on. So if you're listening and this resonated with you on any level, I just want to encourage you to go find Joshua in their clinic. I'm going to put the links in the show notes, but Josh, do you have any final parting words?
Just that I want to encourage your listeners that there's lots of stuff out there and the world is getting better far faster than it's getting worse. And that's actually not been obvious throughout human history, but it's very obvious now. There's cures for things being developed every year. There's advancements in treatment that are being discovered every year. Um, and if you're coming at it from a purely objective standpoint, there's reasons to be optimistic. And I really, really do believe that. Now, we don't get that message from the media. We don't get that message from social
Right.
media. We don't get that message from anywhere, but it is true nonetheless. It's in the statistics. The world is getting better far faster than it's getting worse. And there's reasons to stay in the game. And there's reasons to continue fighting. And there's reasons to continue looking for good tools to make our lives better when we're suffering, and to not give up. And I really do feel that.
Absolutely. Well, that was like 7 amazing bullet points that I'm sure we're going to put in. No, really good, really, really good, encouraging stuff, because we forget. And then it kind of goes back to what you look at or what you reach for, we agree with it, right? Kind of subconsciously. And so, so I love what you shared about, reaching for the right things, and the right things are filled with hope, and we do have a bright future. And if I look back at myself, 12 years ago, sitting in that naturopath's chair, feeling like I'm falling apart, and just where my life has come from that point, like you were saying, with you and Michelle, it's amazing what we can recover from, and not just recover from, but become a better version of ourselves
Yeah.
through it.
I did a little bit of work with individuals who are at the Center for Intrepid at Walter Reed, which is basically a rehabilitation facility that gets amputee patients on top of Mount
Wow.
Everest and all kinds of stuff. And there's actually tons of soldiers that do that. It's absolutely wild. You're like, well, what does that mean exactly when a double amputee climbs Mount Everest? What does that mean? And what does it mean when somebody with no legs does something that typically requires legs that they couldn't do before the injury?
Right.
And I think that we need to remind ourselves that we don't know who we could be across time. We don't have a great vision for the future sometimes, but we can be something that we would be impressed by.
Right.
And I think that that can happen. Not just can happen, but it's worth pursuing. It's eminently worth pursuing.
Absolutely. Absolutely. No, so encouraging. Thank you so much for taking the time to nerd out with me on this topic of trauma and EMDR. I want to have Michelle on eventually and chat about some other things. So I'm going to reach out to her for that. And we will
You'd love that.
definitely do another episode specifically a little bit more on neurofeedback and maybe some case studies. That might be fun.
That would. I've got some case studies I'm allowed to use that I have releases for, and a lot of pretty pictures of brains and things like that. That would be a lot of fun.